Everybody, Dr. Ben Bloomer here again today over at Thrive Physical Therapy in Chanhassen, Minnesota. In just a minute, we're going to get started with our discussion today. It's been a while since I've reached out to you guys. I apologize for that. But we're going to get to part 3 of our 5-part series today, tackling ultimately, by the time we're done, 10 myths about physical therapy, 10 things that people often misunderstand or don't even know about physical therapy. So in just a minute, we're going to get started with part 3. So far, I just want to recap. You can go back and check out my last 2 parts of this piece. Part 1, we tackled 2 myths. The first myth we ended up debunking and saying ultimately that you do not need a referral to come to physical therapy anymore. That's awesome. We've got doctorates in physical therapy. Anybody out there can call us. Our number is 952-491-4700 or book online at our website, www.thriveptmn.com, and book an appointment anytime. You can come right in, no referral needed. The second piece of that series, part 1, the 10 myths, was that physical therapy can significantly reduce the costs of healthcare. A common myth out there is that physical therapy is very expensive, but when you look at it and compare it to some of the other avenues for treatment of health, whether it's going to see your doctor, having an injection, pain medication, surgery, or some of the other entities out there that might not take your health insurance, physical therapy is very cheap and ends up reducing significantly the cost of healthcare. So that was part 1. Part 2, we took a look at 2 other myths, and we ultimately realized with these 2 different myths that number 1, PT doesn't stand for pain and torture. PT stands for physical therapy. A lot of people think that PT is going to be pain and torture and that you're going to hate it, and every time you come you're going to leave in more pain. That is definitely not true. A skilled physical therapist can find any exercise for anybody, things that you can tolerate without causing more pain and more torture. Yes, there might be some soreness and some achiness, but a skilled therapist can meet you where you're at, starting very simple, very basic. The other myth that we tackled that day was that ultimately we said you can take your referral to physical therapy anywhere. Even if you go to a doctor at say TRIA or Twin Cities Orthopedics or Ridgeview or Park Nicollet, and they tell you to go to our physical therapy department at TRIA, Park Nicollet, et cetera, you can take that referral and that piece of paper to any physical therapist that you want. So if you want to come here to Thrive, we're completely independent, we're small, we're one-on-one with myself and the patient. When you call, you get a direct answer from my wife Amanda at the front desk. You don't have to get put on hold, press 3 for the physical therapy department, et cetera. So we said, nope, you can take that referral anywhere that you want. So that's where we're at so far. If anybody who's out there watching right now or watching on the playback, I always love to know where you're watching from, so give me a shout out. If you're watching from some of my friends over in Wisconsin, if you're watching here locally in Chanhassen or Eden Prairie or Chaska, let me know where you're watching from. Give me the like button. Love all that kind of stuff from you guys. Thank you very much, and thanks for watching. So without further ado, we'll get into part 3 of our series, our 5-part series. And today we're going to tackle 2 more myths or common misconceptions, things that people don't know about physical therapy. And I'm loving to spread that word out there, spread that word of how great physical therapy is and how much it can impact you and affect your lives. The next myth is kind of a tough one for me going in as a physical therapy student. Going through my doctorate program, I thought that I was going to go out there and, fix people in 1 visit or 2 visits. And as much practice and experience I get, I start to realize more and more that, simply that's not realistic. And a lot of my patients have that misconception that they're going to walk in here for their first or second visit and they're going to walk out being cured, fixed, back to being 100% pain-free, living their lives the way that they want to be. And as much as I hate to say it, unfortunately, that is a myth. That's not true. But what I can tell you is that ultimately physical therapy is going to be your best long-term option for managing things like pain, weakness, stiffness. No physical therapy is not going to be the quick, easy, short-term fix. There are other types of providers out there who may get you feeling better for a day or 2 days. If you're lucky, maybe 3 days. Maybe if you get a shot of cortisone, maybe it lasts a couple months. And that's great, but I'm here to tell you that unfortunately, those other options out there, those are all just a temporary short-term fix to your pain, your weakness, your stiffness, and they're not going to help you in the long term. Ultimately, physical therapy is going to be the best option long term at managing your pain, your weakness, your stiffness, your dizziness, whatever it is that you might be coming in for. And I'd like to ask you guys, was there ever anything that you accomplished in life that came easy to you? And if there is something, feel free to respond, write it down in the comments section below. Maybe there are a few things that for those of you out there, you're really naturally good at something. But for the vast majority of us, nothing worthwhile really comes easy. And that's the joy. You put in all that hard work for a few weeks, maybe a few months. You pour a lot of blood, sweat, and tears into it. And you end up seeing some really awesome positive results and awesome positive outcomes. And I think that that's what physical therapy is all about. I tell my patients oftentimes the first week or two of starting up your physical therapy program, you might not feel any better at all. In fact, you might feel a little bit worse just because it's new exercises, new things that we're teaching you that your body's not going to be used to. Guess what? That's very normal. That's to be expected. But starting right around that 2-week point is when we typically start to see at least a little bit of improvement, and more and more and more each week as we work together. So again, to recap, ultimately I'm going to tell you physical therapy is not a quick fix. It's not just a quick temporary relief or short-term solution. It is the best long-term fix, long-term solution that's out there, that if you're willing to put in the time, the hard work, the energy, soak up like a sponge all of the things that I teach you, you're going to have a great long-term benefit and outcome, hopefully lasting forever. So that's the first piece to today's talk. And if there's any questions out there, whether you're watching right now or again watching on the playback, please feel free to post them in the comments section below. Or if there's somebody out there that needs to hear that message, that, hey, it's not going to be easy. It's going to take some work. It's going to take some hard work and effort, but hey, it's really going to be worth it. If you know somebody like that, please tag them in the comments below. I'd love to hear from them. I'd love to look out for them. Would love to work with them. So that's the first one that we're going to talk about today. The next myth that we're going to tackle today, again, 2 myths each time. So here we are, part 3 of our 5-part series. The second myth that we're going to tackle today is that physical therapy is only for musculoskeletal conditions. And what I mean by that is a lot of people out there think that physical therapy is only for people with injuries to their muscles, their tendons, their ligaments, their bones. Maybe somebody who's had a surgery, whether it's ACL surgery or a rotator cuff surgery or a knee replacement, hip replacement, whatever it may be. People oftentimes think of physical therapists as the expert after an injury happens and only for muscles, tendons, bones, joints, ligaments, those types of physical structures within the human body. And I'm here to tell you again that that is completely false. Physical therapists are now experts in almost everything of the body, head to toe. So I'm just going to go through a few different diagnoses that we as physical therapists are trained to treat. Some of us specialize in these types of things. And some of these things, I'm guessing, if you're sitting watching at home or watching at work, You're going to be very surprised to hear that a physical therapist can help with that. First of which I'll say is dizziness and vertigo. It is a very common thing that I treat and some other physical therapists treat. Not every PT, certain ones do, I do. So anybody who's out there experiencing dizziness, feel like the room is spinning, feel very lightheaded, oftentimes that's a sign of a certain physical problem, oftentimes within your inner ear, your vestibular system, or your body's balance system, the way that your brain connects with your nerves to your muscles. And oftentimes that's something that physical therapists can help you with. So if you're out there experiencing dizziness or vertigo, give us a call, shoot us an email. We'd love to see you. We do free 15-minute assessments here as well to see if physical therapy is something that can be helpful for you. I'm going to go down the list of some of these other diagnoses that physical therapists do treat, I treat, and as